Renal artery stenosis and renal vein thrombosis are both conditions affecting the kidneys, but they have distinct differences. Here are 15 differences between them. 1. Location of occlusion. Renal artery stenosis involves narrowing of the renal artery, which supplies blood to the kidney. Renal vein thrombosis occurs when there is a clot, thrombus, in the renal vein, which drains blood from the kidney. 2. Blood flow impairment. In renal artery stenosis, blood flow to the kidney is reduced or obstructed due to narrowing of the artery. In renal vein thrombosis, blood drainage from the kidney is impaired due to the presence of a clot in the renal vein. 3. Causes. Renal artery stenosis is commonly caused by atherosclerosis, buildup of plaque, or fibromuscular dysplasia. Renal vein thrombosis can be caused by conditions such as nephrotic syndrome, hypercoagulable states, or trauma. 4. Symptoms. Renal artery stenosis may lead to hypertension, high blood pressure, reduced kidney function, or renal artery bruits. Renal vein thrombosis can present with flank pain, hematuria, blood in urine, and sometimes renal failure. 5. Risk factors. Risk factors for renal artery stenosis include older age, smoking, hypertension, and diabetes. Risk factors for renal vein thrombosis include nephrotic syndrome, pregnancy, oral contraceptive use, and hypercoagulable disorders. 6. Diagnostic methods. Renal artery stenosis is diagnosed using imaging techniques like ultrasound, CT angiography, or magnetic resonance angiography, MRA. Renal vein thrombosis is diagnosed using imaging studies such as ultrasound, CT scan, or MRI, along with blood tests to assess clotting factors. 7. Treatment approach. Treatment for renal artery stenosis may involve medications to control blood pressure, angioplasty with stenting to widen the artery, or surgical intervention in severe cases. Treatment for renal vein thrombosis includes anticoagulation therapy, blood thinners, to dissolve the clot, management of underlying conditions, and sometimes thrombectomy in critical cases. 8. Prognosis. The prognosis for renal artery stenosis depends on the severity of arterial narrowing and response to treatment. If left untreated, it can lead to kidney damage and hypertension. Renal vein thrombosis prognosis varies based on the extent of kidney damage and timely intervention. Prompt treatment can prevent long-term kidney complications. 9. Incidence. Renal artery stenosis is relatively common, especially in older adults with atherosclerosis, affecting a significant proportion of individuals with hypertension. Renal vein thrombosis is less common, but can occur in specific populations such as those with nephrotic syndrome or pregnant women. 10. Acute versus chronic presentation. Renal artery stenosis can present acutely with severe hypertension or chronically with gradual deterioration in kidney function. Renal vein thrombosis often presents acutely with sudden onset flank pain and hematuria, or chronically with persistent renal dysfunction. 11. Associated conditions. Renal artery stenosis is associated with conditions like coronary artery disease and peripheral artery disease due to shared risk factors. Renal vein thrombosis may be associated with conditions like deep vein thrombosis, DVT, or pulmonary embolism, especially in cases of hypercoagulability. 12. Management challenges. Managing renal artery stenosis involves balancing blood pressure control and preserving kidney function, which may require multidisciplinary care. Renal vein thrombosis management includes addressing underlying causes and preventing recurrence of thrombosis, often requiring ongoing monitoring. 13. Impact on kidney function. Renal artery stenosis directly affects kidney perfusion and function due to reduced blood flow. Renal vein thrombosis impacts kidney function due to impaired drainage and potential damage from clot-related complications. 14. Preventive measures. Preventive measures for renal artery stenosis include managing cardiovascular risk factors and early detection in high-risk individuals. Preventive measures for renal vein thrombosis focus on managing underlying conditions that predispose to clot formation, such as nephrotic syndrome or hypercoagulable states. 15. Follow-up and monitoring. Follow-up for renal artery stenosis includes regular blood pressure monitoring, kidney function tests, and imaging to assess arterial patency. Follow-up for renal vein thrombosis involves monitoring kidney function, anticoagulation therapy, and surveillance for recurrence or complications. These differences highlight the distinct mechanisms, clinical presentations, and management approaches for renal artery stenosis and renal vein thrombosis.